How do neurological pathways control bladder emptying? Have you ever wondered how your body knows when it's time to go to the bathroom? The process of bladder emptying, also known as micturition or voiding, is quite fascinating and involves a complex system of neurological pathways. These pathways include the brain, spinal cord, and peripheral nerves, all working together to ensure that urine is expelled from the bladder at the right time. At the heart of this process is a special area in the brainstem called the Pontine Micturition Center. Think of it as a control center that helps switch your body from storing urine to actually voiding it. When your bladder fills up and reaches a certain level, stretch receptors in the bladder will send signals through nerves to the spinal cord and then to this control center. The Pontine Micturition Center responds by sending signals back down to the bladder to start contracting and to the sphincters to relax, allowing urine to flow out. There are several key pathways involved in this process. First, we have the parasympathetic pathways that come from the lower part of the spinal cord. These nerves releases a chemical called acetylcholine, which activates receptors on the bladder muscle, called the detrusor. When these receptors are activated, the detrusor muscle contracts, increasing pressure in the bladder and pushing urine out. On the other hand, during the time when the bladder is filling, sympathetic pathways play a crucial role. These pathways come from the upper part of the spinal cord and help maintain the tone of the urethra. They do this by stimulating certain receptors in the urethral smooth muscle, keeping it contracted to prevent any leakage. Additionally, these pathways inhibit the detrusor muscle from contracting, allowing the bladder to fill comfortably. There are also somatic pathways that control the external urethral sphincter. This sphincter is under voluntary control, meaning you can consciously decide when to relax it to allow urine to flow. This is managed by specific motor neurons in the lower spinal cord, which keep the sphincter contracted during bladder filling and relax it during voiding. Higher brain centers, including parts of the cerebral cortex, also play a role in bladder control. These areas help you decide when it is socially appropriate to void. They can either encourage or inhibit the Pontine Micturition Center, allowing you to control your bladder in different situations. When it comes time to empty the bladder, the Pontine Micturition Center activates the parasympathetic pathways to contract the bladder while simultaneously inhibiting the sympathetic and somatic pathways. This coordinated effort allows for effective bladder emptying. If any part of this intricate system is disrupted, it can lead to bladder dysfunction, such as urinary retention. This condition occurs when the bladder cannot empty completely, which can increase the risk of infections and other complications. This is particularly important for individuals with bladder health issues or bladder cancer, where neurological control may be affected by tumors or treatments. In summary, the control of bladder emptying is a well-orchestrated process involving multiple neurological pathways. From sensory input to brain processing and motor output, each component plays a vital role in ensuring that your bladder functions properly. Understanding this complex interaction can help us appreciate the importance of bladder health and the potential issues that can arise when things go awry. Always remember to consult healthcare professionals for personalized advice regarding bladder health and any concerns you may have.